Good afternoon and welcome to another installment of Bingham Healthcare's Be Informed webinar series. I'm your host, Michael Brandes. And this afternoon, I'm excited to introduce our guest. We have with us today Dr. Brian Thomas, who is an ear, nose, and throat doctor who sees patients in Idaho Falls and Blackfoot. Welcome, Dr. Thomas.
Thank you. Glad to be here.
It's a pleasure to have you. So just to let everyone know, what we're going to be doing is the initial broadcast is live, is being streamed live on Facebook. So please feel free to submit any questions that you have for our doctor as the webinar goes along. We do have several questions that have been asked in advance, so I'll be asking those questions to Dr. Thomas, and he'll be answering those for all of our viewers. If you're actually seeing this video after it's gone live and it's been recorded and you're seeing it either on Facebook or on YouTube and you have questions for our doctor, we would still welcome those. So please feel free to submit your questions, and our social media team is always monitoring our Facebook and YouTube pages, and we'll be sure to submit those to Dr. Thomas and provide you with response to those questions. So what I'm going to do is go through and have Dr. Thomas talk a little bit about himself so you can get to know him a little bit better. I can tell you he has been a doctor with Bingham Healthcare for a couple of years now. And then I'm going to have him talk a little bit about his background and why he ended up, what inspired him to go to medical school. And then from there, what we'll do is we'll go into the Q&A portion of the webinar. So again, welcome, Dr. Thomas. If you could maybe just talk a little bit about your background and what inspired you to go to medical school.
Okay, thanks. Yeah, so my name is Brian Thomas. I actually grew up in this area. I grew up in a family farm just outside of Rigby. And I went to medical school as I got started thinking about medicine because my mom was a nurse, and I was really interested in the things that she did in her work, and really liked the opportunity to kind of both learn a lot about the human body and be able to have a way to help a lot of people. And that's what kind of got me started heading towards medical school. When I got into medical school, I decided to be a otolaryngologist or ear, nose, and throat surgeon because I loved the anatomy of the head and neck, all the intricate details and relationships between all the different things that make your head and neck work together, and also the nature of problems in ENT that, as an ear, nose, and throat surgeon, there are a lot of things that we're able to treat both medically and surgically, and to be able to have kind of all those options available to me, whereas a lot of specialties, either you're the person who does the medical treatment or you're the person who does the surgery, and not doing both sides of it like I do in ENT. But yeah, so I did medical school at Dartmouth, so I was out in New Hampshire for a number of years, and then I worked in Montana for a few years after I got out of medical school, and then a couple of years ago I finally got the opportunity to come back home, and I'm happy to be back here in Idaho.
That's excellent, Dr. Thomas. Thank you very much for sharing that information with us. Now, maybe going a little bit further, I imagine that sometimes a lot of people don't really know some of the specifics about what an ear, nose, and throat doctor does on a daily basis and what kinds of patients you see. Maybe if you could just elaborate on the types of patients that you see. I imagine patients of all ages, and you can correct me if that's not right. But I would imagine just at a higher level, you see patients with sinus diseases, head and neck cancer, tonsil problems. Perhaps you could elaborate a little bit more on some of the different areas that you focus on and the types of patients that you would see.
Okay, yeah. So I do see patients of all ages. As an ENT, I tend to see kids pretty often, but I see, every age from 6 months old to 100 years old. And it's a good way to think about what I do as an ENT is most problems in the head and neck that aren't in the brain and spinal cord and aren't in the eyes fall under ENT. So I do a lot of work with the nose and sinuses and kind of treating the obstruction that you get with allergies or sinus infections. You do a lot with the ears, with younger kids who need ear tubes, occasionally even adults who need ear tubes, or surgeries for chronic ear infections or holes in the eardrum. I do a lot of tonsillectomy for people who have problems with their tonsils, and then a lot of neck surgeries for lumps and bumps or cysts or tumors in the neck, to take those out and do the treatment for those.
That's excellent. I know some of the other things that maybe I wanted to mention that you could talk a little bit about. I know you did mention this, that you specialize in neck mass and lymph node removal, saliva gland surgery, sinus surgery, septoplasty, and I know that you also specialize in working with patients with thyroid and parathyroid issues. And you perform tonsillectomies. Are all those still? Is all of that correct, Dr. Thomas?
Yeah, that's all correct. And those are all things that I enjoy and like doing.
Okay, excellent. Okay, so now that Dr. Thomas has given us a little bit of a background on himself, what we're going to do is move into the Q&A portion of this. Like I mentioned earlier, people submitted questions that we're going to be asking Dr. Thomas. And if you're watching this live with us today on Facebook, please feel free to continue submitting questions. And I will be able to I will continue to ask those questions if they come in. And if we don't have time for those, then what I'll do is I'll submit those. Our social media team will submit those questions to Dr. Thomas, and we will be sure to respond to you as quickly as possible. So please feel free to ask as many questions. We just want this to be as informative for you and your family as possible. The one thing I would like to make is a disclaimer, just to let you know that even though Dr. Thomas will be answering medical questions, we just have to let you know that it cannot be considered as a diagnosis. It's just more general information. And what will ultimately happen is, if you'd like to schedule an appointment with Dr. Thomas, you can schedule an appointment and be able to see him, and then he can officially diagnose you or one of your family members, and then that's when it would become an official diagnosis. And just to let you know that Dr. Thomas sees patients at the Comprehensive Cares Clinic here in Idaho Falls. That's located off of Sunnyside Boulevard right before Hit Road. The phone number for the Comprehensive Cares Clinic is 208-524-9400. Again, the phone number to schedule an appointment with Dr. Thomas is 208-524-9400. And Dr. Thomas also sees patients in Blackfoot at 98 Poplar Street. And the phone number to contact him and schedule an appointment to see him in Blackfoot is 208-785-3800. And if you'd like any additional information about Dr. Thomas and to read his full bio, you can go to binghamhealthcare.org. Again, you can go to binghamhealthcare.org to learn additional information about Dr. Thomas that we perhaps weren't able to get to today. Okay, so Dr. Thomas, the first question that I have from a viewer is, I recently went to my dentist and they did a full mouth x-ray. The last one was done about 4 years ago. This time he pointed out that I had about 50, and excuse my pronunciation of this, tonsilliths, and to tell my doctor on my next appointment. I have been getting earaches, but my doctor did not see any sign of infection in my ears. In the x-ray, I could see these bits down by my jaw, but exactly what are they? What are they in? Do they eventually dissolve? And my tonsils do not seem swollen, and so far no bad breath. So Dr. Thomas, how would you like to respond to this viewer's question?
Thank you. It's a a good question, and it's a problem that a lot of people deal with. Tonsil stones or tonsilliths they're a very common issue. What they are chunks of debris and bacteria that collect in the little pockets or crypts in the tonsils. And your tonsils, if you haven't looked in your throat and seen where they are, if you look at the back of your throat, where there's the uvula that hangs down in the middle, and then on either side of that, there's a tonsil, which is this kind of lumpy, bumpy tissue to the side of the uvula. And the tonsilliths form in the little crypts or the little pockets in those tonsils. I'd say most people probably have a few tonsilliths. They tend to be more common and more problematic in people who've had a lot of tonsil infections, but they don't always have to go along with tonsil infections. They commonly can cause bad breath, but not always. And then where they're associated with frequent infections, a lot of times you can have some infection or irritation around the tonsilliths that will cause some soreness. For most people, the soreness is mainly in the throat, but you can have referred pain in the ear because of the overlap of the nerves from your nose, from your throat, and from your ear. So it's possible that the ear pain that you're feeling may actually be from irritation around those tonsilliths. They typically don't really dissolve over time, but they do tend to gradually make their way to the surface of the tonsil and then fall out, and you either swallow them, or if you notice them, a lot of people spit them out. If they are getting to the surface where you can see them and you're having any irritation, often you can dislodge the tonsil stone using a water pick or a cotton swab. If you're getting the tonsil stones and they're causing a lot of trouble, the only real curative treatment for them is tonsillectomy. If we take the tonsils out, those crypts or little pockets where they collect are gone, and you don't have any more tonsil stones. They have to be causing a fair amount of trouble to be worth doing a surgery for, but that's the definitive treatment for them.
That's excellent, Dr. Thomas. Thank you very much for elaborating on the viewer's question. And to the person who submitted that question, thank you very much. And hopefully that was helpful for you. And again, if you would like to see Dr. Thomas and talk to him further about what you may be experiencing, please feel free to schedule an appointment. He'd be more than happy to see you. Okay, so the next question that we have from a viewer is, my nasal passages get very dry. It can even get extremely painful. I have resorted to putting triple antibiotic ointment up my nose with a Q-tip at night for lubrication. Is this safe for me to continue to do?
So the short answer is yes. And that's actually something that I frequently recommend to patients who have dry nasal passages. I would recommend sometimes putting it in your nose with the Q-tip. The Q-tip can cause some irritation and undo some of the good that the ointment's doing. So what I recommend is that you put a little dab of the ointment on the tip of your finger, and then with your finger, you just wipe it off into the very front of your nose, and then you can squeeze the outside of your nose to spread the ointment out. And that way you can get the ointment up in your nose where it needs to go without having to worry about the Q-tip causing irritation or rubbing the side of your nose too much. If your nose isn't as dry, doing saltwater spray or saltwater rinse can also work really well to moisten the nose. But the ointment stays there longer, and so if your nose is really dry, the ointment, like the triple antibiotic or Vaseline, tends to work the best.
Okay, excellent. Thank you, Dr. Thomas. And just piggybacking on that question a little bit, I imagine, and I'm just wondering if maybe you're seeing a lot more patients lately who have been experiencing dry nasal passages and irritated throats as a result of all the smoke fire in the air. Have you been noticing that? It's been a pretty heavy fire season.
It has been, and I definitely have. The dry air and all the smoke causes irritation in addition to the dryness. So there are a lot of people who normally have minor problems and are having worse, and people who normally don't have any trouble with their nose getting dried out that are starting to have trouble this year.
Okay, great. So the next question that we have is, I've lost my sense of smell, not COVID related, and was wondering if this can be treated or what the cause could be.
So thanks. That's a good question, and it actually ends up being a fairly broad topic because there are a lot of different things that can cause you to lose your sense of smell. The most common reason to lose your sense of smell is obstruction, that something is blocking the air with the little particles that give you the odor from getting up in your nose where the olfactory epithelium is that lets you smell things. Obstruction can be from swelling, from irritation in your nose, from allergies, from infections. In rare cases, if a tumor is growing in that area, that can cause you to lose your sense of smell. So the first step is figuring out what's causing the problem. Most of the time, once we find out what's causing you not to be able to smell, then there are treatments directed at, if it's chronic infections, we take care of the infection. If it's nasal polyps, we can take out the polyps. And so most of the time, if there's an underlying issue that's causing the loss of smell, we can take care of that initial problem, and then the sense of smell comes back. So there are treatments. I know you said yours wasn't from COVID. COVID is a little bit different category, and there are some other viruses as well that can cause you to lose your sense of smell without causing obstruction, that they damage the nerves that do your sense of smell. There are some treatments for that as well. But yeah, so the first step is finding out what's causing the trouble.
Okay, excellent. Thank you, Dr. Thomas. The next question that's been submitted is, I'm getting older and I worry about hearing loss. Are there screenings you offer, or at what age do you recommend regular hearing screenings?
So it's another good question. There's actually not a kind of defined recommended age to start hearing screenings. But I would say anytime you're starting to get concerned about your hearing, that's a good time to have your hearing checked. And a lot of times you may not notice hearing loss because it happens gradually, but the people around you may notice it before you actually realize that you have some hearing loss. So family and friends can be a good source for knowing when it's time to get checked. Another thing to pay attention to is if your parents or grandparents had hearing loss around the age that they started to notice hearing loss, is a good time to have your hearing checked, because a lot of hearing loss is hereditary in how quickly your ears wear out over time. I do some hearing screening for people who have kind of concerns about hearing loss and need a full hearing test. Then I would get connected with one of the audiologists in town to get a full hearing test.
Okay, excellent. And maybe adding a little bit onto that, I imagine I used to think about I mean, even just like some treatments for hearing loss, having large, really big hearing aids. I imagine there have been so many technological advances in treatments for hearing loss that people might be surprised. Is that true?
That is, that there are more options, and they're getting to be more and better options all the time. So in some cases, treating hearing loss is as simple as cleaning a big wad of earwax out of the ear canal. In some cases, it's hearing loss that we can't fix directly, and then hearing aids are the best option. And the hearing aids are getting better and smaller all the time. Depending on your hearing loss, there are ones that can fit completely in the ear canal where you can't really see them from the outside. And for some types of hearing loss, they're actually surgically implanted hearing aids that we anchor in the bone by the ear and avoid having to have anything in the ear canal. So there are, more and more options all the time.
Okay, thank you. And you had mentioned earwax. That's a great segue. There was another viewer that's asked a question, and we have a couple of different questions related to earwax. I am a person who produces a lot of earwax. I know that cleaning out my ears with Q-tips is bad, but I produce so much that I have to clean my ears daily or else I feel gross. Are there any other solutions for cleaning out ears, or is producing too much earwax a sign of some disorder?
So my rule of thumb with earwax, some people make a lot of earwax, some people make very little. As long as the earwax is clearing out as quickly as you make it, however much you make, that's okay. So if you're one of the people who makes a lot of earwax, there are a few different ways of cleaning the earwax out. The one that I like the best and avoids having to use a Q-tip is using either the commercially available eardrops, which are a combination of peroxide and mineral oil, or you can make your own half and half peroxide and mineral oil eardrops. Using a few of those helps to soften the wax and break it loose, and then rinsing your ear out in the shower a few minutes later often works pretty well to clear out the earwax. If you are going to use Q-tips, it's actually better to use them every day than to use them just once in a while. Because if you use them infrequently, then you get a lot of wax that builds up, and then the Q-tip pushes some of the wax in and gets some of the wax out, and you gradually pack your ear canal clear full of wax. So if you're going to use the Q-tips, using them every day like you do is the better way to do it. And I would just be cautious with it, and don't put the Q-tip too far in the ear canal, and avoid doing other things so that your hand's not getting bumped while you're using the Q-tip and end up damaging your ear.
Okay, excellent. Thank you, Dr. Thomas. And again, thank you to the viewers. I know there were a couple of questions related to earwax. I hope that Dr. Thomas's response helped both of the viewers that asked about had earwax questions. And I think that was some very useful information. Again, thank you for that, Dr. Thomas.
You're welcome.
So the next question that someone has submitted is, my 2-year-old often snores when she sleeps, which causes her to sleep restless through the night. I've heard getting her tonsils removed could help, but is 2 years old too young to remove tonsils?
So it's a good question, and one of the more common things that I see young kids for. 2 years old, so tonsils cause two main categories of problems. The more well-known one is infections, strep throat, recurrent tonsillitis, and that typically happens in older kids and adults. In younger kids, the main problem that the tonsils cause is that they take up a lot of space and can cause snoring and breathing problems during sleep. And that's a continuum from some kids just have very light snoring and it's not disrupting their sleep, and some kids have a lot of obstruction and have sleep apnea, where they are stopping breathing for several seconds over and over through the night. One of the main treatments for the obstructive symptoms during sleep is taking out the tonsils. As far as age, 2 years old is about as young as I would recommend taking the tonsils out. Any younger than that, and the risks outweigh the benefit that we're getting with the surgery. In general, if the symptoms are moderate or not too bad, a lot of kids do better with the recovery if we can wait till they're 3 years older or older. But we definitely can, and I do take tonsils out in kids who are 2 years old.
Okay, thank you. Now, something that was interesting to me is you had mentioned that kids can actually be diagnosed with sleep apnea. So is that something that can be diagnosed at all ages? And do you work with patients with sleep apnea, or do you diagnose sleep apnea?
So that's a good question. It definitely can be all ages. And I work in kids most of the time. The main problem and the main treatment is taking out the tonsils and the adenoids to take care of the sleep apnea. In adults, sometimes it's still big tonsils that are causing the problem. And sometimes the obstruction is in other areas. So with adults who have sleep apnea, I do a very thorough exam of the whole airway, from the nose to the mouth and back of your throat, and then down to your larynx or your voice box, and then tailor the treatment plan for where the narrow areas are or where the obstruction is. And for adults, sometimes surgery is a good option for treatment. Sometimes positive pressure or the CPAP, the mask that you wear at night, ends up being a better treatment option. So there's a more of a variety of treatments for adults than what we typically do for children.
Okay, and I imagine those treatments would just all, again, you would talk to the patient and it's all based on individual needs, as opposed to a one-size-fits-all.
Yeah, exactly. That for some patients, surgery is the best option. For some patients, surgery is not as good of an option, and we're talking about other treatments.
Okay, excellent. And actually, we have another question that someone just submitted about sleep apnea. They wrote, and it's probably ties into what you just said, but I'm going to ask it. It's a little bit different. I oftentimes wake up with headaches in the morning and have been told this could be a case of sleep apnea. However, I have never been told that I snore and don't feel as if I am short of breath. Could this be related?
So it could be related. Sleep apnea can commonly cause headaches in the morning. And a simple way to determine whether it's from sleep apnea or not is to do a test where we monitor your oxygen level overnight. It used to be that pretty much the only test for sleep apnea was a sleep study where you'd have to come in and kind of sleep in the sleep lab overnight with a bunch of different monitors. We still do that fairly often, but for people like yourself who were just trying to decide if sleep apnea is the problem, there's a much simpler option now that you can do at home where it's just an oxygen monitor that you wear on your finger overnight and get a better idea of whether this is sleep apnea or not. If it is sleep apnea, generally treating the sleep apnea takes care of the headaches in the morning. If it's not sleep apnea, there are a number of other things that can cause morning time headaches, and then we'd need to find out some more information and work on figuring out which thing is causing the headaches.
Okay, thank you, Dr. Thomas. The next question that we have is, my child is now 8 years old and recently had an ear infection. Is 8 too old to get ear tubes? And after how many ear infections do you recommend looking into ear tubes?
So 8's definitely not too old for ear tubes. I think about the oldest patient I've done ear tubes on was in their 90s. So I do ear tubes on patients of all ages. They're definitely more common in younger kids who are 1 or 2 years old. So it's less common to need them at 8, but they're definitely not too old. I start thinking about ear tubes in people who've had 3 infections within 6 months or 4 infections in a year. And there are other things to consider as well. Sometimes when people get an ear infection, there's fluid that stays and just lingers behind the eardrum and can cause hearing loss. If that fluid stays there and we can't get it to clear out over the space of about 3 months, then even with 1 ear infection, we'd potentially be talking about ear tubes. Most of the time, if your son's just had 1 ear infection and recovers normally and isn't having trouble, most of the time he wouldn't need tubes.
Okay, thank you. That was, I think you provided some pretty good guidelines there. And again, thank you to the viewer who participated. Just to let our viewers know and let Dr. Thomas know, I know that we're nearing the end of our live webinar. We have a couple more questions. I'm going to continue to try to get to as many as I can before we run out of time. But I appreciate everyone who has participated in our webinar today and who have submitted questions. This has been really interesting and we hope helpful to you as well. The next question, Dr. Thomas, that someone has submitted is Tinnitus Hereditary.
So tinnitus, or ringing in the ears, it can be hereditary. It can have a lot of different causes. So if you have multiple family members with tinnitus, then it's more likely that you're going to have tinnitus. But it can be from a number of other things as well. So that's, I guess, the short answer for that question.
Okay, awesome. Thank you. The other thing that I wanted to ask you about, and I know this is something that a lot of people experience, is deviated septums. Is that something common? Is that do you see patients a lot of times with deviated septums, and do you perform surgeries to help with that?
So yes to both. So a deviated septum is extremely common, and that's the wall between your 2 nostrils that separates your nose into 2 sides. That's what the septum is. And a deviated septum just means that there's some curve or some bump somewhere on the septum. So if you're really picky about what you call a deviated septum, almost everyone has one. And it's something that if it's a minor curve or a small bump and it's not causing any trouble, we don't have to worry about it at all. If there's a bigger curve and it's causing obstruction or causing any troubles, then surgery to straighten out the septum is definitely something that we do and can help that obstruction and get the nose more open if it's causing trouble.
Okay, thank you. We're nearing the end of the Q&A portion of our live webinar, but I did want to talk to you a little bit more specifically, Dr. Thomas, and perhaps you could elaborate on this. I know we've had a lot of really great questions today, but I kind of wanted to bring it back. I know a lot of times when you're having your annual physical, which we highly recommend at Bingham Healthcare, that you see your primary care physician on an annual basis, on a yearly basis, just to be able to go through and have all of your blood work taken, look at your numbers, do an overall evaluation. And then if they notice anything unusual, like with your ear, nose, and throat, or you're having any issues, then your primary care doctor would refer you to Dr. Thomas for further evaluation. But I also wanted to let you know that Dr. Thomas actually allows or permits self-referrals. So if you're experiencing something with your ears, nose, and throat, you're more than welcome to call and schedule an appointment with Dr. Thomas in his office directly. And a lot of times during an annual wellness exam, your primary care doctor will evaluate your thyroid numbers and feel your neck for your lymph nodes and evaluate your neck for any lumps or bumps. I wanted to have you talk a little bit about Dr. Thomas. What is it that you work with those types of patients, and how do you work with patients with thyroid issues? And maybe if you could just elaborate on that for a little bit.
Yeah. So thyroid issues are one of my favorite things to work with in ENT. And so I see a lot of patients who have either they felt a lump, or their primary doctor has felt a lump, or they've had an ultrasound or some scan of their neck for some reason, and we find a lump in the thyroid. And once we find a lump in the thyroid, then we can do some non-invasive or kind of simpler tests to try and determine if we need to be worried about a cancer in this lump, or look for whether the lump is causing any symptoms. If it's one that we're worried about it having cancer, or if it's big enough that it's causing trouble with swallowing or causing other symptoms, then we can do a surgery to take out the lump and the part of the thyroid right around that and find out for sure what it is. So that's something that I do fairly commonly, and I enjoy the process of investigating and figuring out whether this is a lump that we need to be worried about, as well as the surgery to take the lump out if that's what we end up needing to do.
Okay, excellent, Dr. Thomas. So just to let everyone know, we've reached the end of our Bingham Healthcare webinar. Dr. Thomas, I really appreciate your time today, and I always like to ask my guests at the very end. I feel like we've had a very great conversation. You've been able to cover a lot of different areas of your specialty and why you see and what the types of patients that you see. I just wanted to make sure that we perhaps weren't a little bit too vague. I wanted to give you an opportunity, maybe if there's other things that you've thought about during our conversation that you would like to elaborate on. I just wanted to give you one more chance to speak to the public and let them know about your specialty.
Thank you. I've enjoyed being here, and I feel like we've covered a lot of the main areas of ENT. Just with the neck lumps and bumps that we were just talking about, often it's thyroid, but any other lumps or bumps in the neck are things that I enjoy dealing with and kind of investigating to find out what it is and take care of the ones that we need to worry about and be able to reassure people on the ones that we don't need to worry about. But thank you for having me.
Okay, you're welcome, Dr. Thomas. And again, we'd like to thank all of our viewers for participating and for being with us this afternoon. Again, Dr. Thomas sees patients in both Idaho Falls and in Blackfoot. In Idaho Falls, he sees patients at the Comprehensive Cares Clinic off of Sunnyside, right before Hit Road. And his office phone number is 208-524-9400. Again, 208-524-9400. 9400, and he sees patients in Blackfoot as well at the Idaho Physicians Clinic, part of Bingham Healthcare, at 98 Poplar Street. And his office, if you'd like to schedule an appointment in Blackfoot, is 208-785-3800. And if you'd like additional information about Dr. Thomas or any of our doctors, we have over 160 doctors at Bingham Healthcare that specialize anywhere from family medicine, OBGYN, dynamic group of OBGYNs, we have an orthopedic and sports medicine team, cardiologist, again, a number of different specialties that all of our providers are here to help you and your loved ones to be able to be healthy and live your best lives. Thank you very much for being with us. And from everyone at Bingham Healthcare, we hope that you and your loved ones continue to stay happy, healthy, and safe. Thank you.